This segment of Delmarva Life is brought to you by Peninsula Home Care.
Dealing with physical obstacles after they've occurred requires a monumental effort. So what if you could delay, maybe even prevent one before it happens?
You'll recall just this week, Dr. Apsara Prasad, a PRMC gastroenterologist, joined us to talk about colonoscopies. She explained that doctors are looking for polyps that look like stalks or flat lesions before they become cancerous and require surgery that could cause catastrophic changes in your life. Now, Dr. Prasad explained how it's done when you go into the doctor's office.
But what if you could find out at home, on your own? Well, the New England Journal of Medicine says a new experimental screening for colon cancer could be yet another tool to prevent one of the top cancer killers in the U.S. Now, unlike a colonoscopy, this new test is non-invasive. It screens for cancer by looking for abnormal DNA and minute traces of blood in the stool. Patients send in samples without needing to visit a doctor.
Colon cancer is one of the most preventable and treatable cancers, but the Centers for Disease Control and Prevention reports 23 million Americans do not get the recommended screening. And as we told you Wednesday, every year close to 140,000 Americans are diagnosed with colorectal cancer, and more than 50,000 people die from it. So the dreaded diagnosis comes back. Now what? Well, here to explain your options is Therese Ganster, Community Liaison for Peninsula Home Care. Thanks for joining us this afternoon. Now, you have a personal reason to really advocate for people to get their colonoscopy.
Yes, I do. It runs in my family. My mom was diagnosed probably about 12 years ago and lived with the disease for 7 years. In the process, it became more well accustomed that you can now talk about it. So I started asking questions and found out that 3 of my great uncles, 1 maternal uncle, and 2 great aunts all died of cancer. Going back and telling that to my physician, he said, you're only 40, but we're going to start you now. And so I had my first colonoscopy back then. And you had to drink a lot more stuff than you do now. It's a piece of cake in comparison to what you need to do now. But they found polyps. And probably at that point in time, it was probably every 3 to 5 years that they then asked me to do it. And then it's every 2 years now, because every time I go, they find one. But at least I know, and I know that the odds are against me dying of colon cancer, and I'll live to see my grandchildren at their college graduations or weddings or whatever from that perspective. So absolutely, please do what needs to be done.
It's worth
whether it's a colonoscopy or the FIT test.
You're being proactive, and here you are, fit as a fiddle.
I'm trying. It's a FIT. It's a FIT test, guys.
That comes in handy. We'll tell you about that in a second. So tell me, what is the approach that Peninsula Home Care takes when it comes to helping out someone at home?
Well, we oftentimes are not in the preventative mode, although we certainly believe in the prevention. But usually what happens is that if you did have colon cancer and it was more than just the polyp, there's a very good chance that, or they found that the polyp was cancerous, they could say that you need chemotherapy. At that given point in time, the good news is that all of our nurses are certified and they can do chemotherapy in the home. Think about this winter that we've just had. Colds, flu, virus, all of the things that you want to be immunosuppressed for. The comfort of your own home. Not having to get out in that snow and the ice to get your program. So being able to do the chemotherapy in the home is one of the things that we really enjoy the most. And our nurses really get to have a wonderful relationship being built in that process.
Right.
And it's not just the medical thing. So I mean, it is. They help with like nutritional support and other services, medical services in the home.
There may be pain management involved, and we can see about alternative methods other than pain medication, although we could help with the pain medication. We can do physical and occupational therapy because oftentimes you're weakened. Wound management because you may have had surgery, and we may need to make sure that that wound is healing in a proper context.
So how do you know what has to be done?
Has to be a doctor's order.
Okay.
Okay. Typically, we will get the referral from the physician. If you're in the physician's office and he says that you need chemotherapy, you can ask him, well, can I have chemotherapy at home? But the order has to come from the physician. And we have to then follow through with a full assessment of what your needs are in the home, and then work from that process as to whether or not physical therapy and occupational therapy can help you also.
And the caregiver really is an important part of the whole process.
Absolutely. Where would we be without our loved ones helping us in that process? And our staff, whether or not it's the physical therapist, occupational therapist, or nurse, engages that caregiver, because that caregiver begins to be the support for that person. Oh, let's take our weights. Oh, did we take your vitals today? Oops, well, you didn't eat as well for breakfast. Maybe we should talk about the breakfast nutrition support that you might be able to take a little bit extra to help from that perspective.
It's a great relationship. Therese Ganster, thank you so much.
Thank
for
you.
that
It's wonderful.
information.
And if you'd like to know more about Peninsula Home Care, go to delmarvalife.com and click on the show tab.